Namaste, aspirants, and welcome. Today, we're jumping into a topic that is quite honestly a perfect case study for your mains prep. It's right at the intersection of cutting-edge science, some really deep social challenges, and the complexities of governance. We're going to be talking about a brand new cell therapy that could totally change how we view aging in India. So if you're gearing up for GS Paper 3, you'll definitely want to pay close attention. So here's our game plan. First, we'll set the scene and talk about the growing challenge of an aging India, specifically a condition called frailty. Then we'll get into the exciting part, a potential breakthrough called Lomecel-B, and explore the science behind it. From there, we'll connect it to the realities of our healthcare system and finish up with the all-important regulatory and ethical side of things. By the end, you'll have all the angles you need for a really well-rounded answer. All right, let's start with the big picture. You know, India is at such a critical point demographically. We hear a lot about our youth dividend, but there's another, much quieter revolution happening. Our population is aging, and this is bringing a whole new set of challenges to the table. I mean, we've all seen it in our own families, right? Our parents or grandparents slowing down, maybe taking a bit longer to recover from a common cold, and we often just chalk it up to, they're just getting old. But what if it's more than that? What if we're actually looking at a specific medical condition that we could potentially treat? Professor Menon, this is where that term frailty comes in. Could you break that down for us? Because it's not simply about old age, is it?
That's exactly right, Dr. Singh. You see, frailty isn't a disease itself. It's better to think of it as a state of accelerated aging. Imagine the body has a sort of reserve tank of strength and resilience. Frailty is what happens when that tank starts running on empty. It's the result of years of low-grade inflammation, losing muscle mass, and just cumulative stress. And that's why a simple fall or a small infection, which a younger person would just brush off, can become a huge life-altering event for a frail person. Their ability to bounce back is just severely weakened.
And the sheer scale of this is mind-boggling. Globally, we're talking about 1 in 4 people over the age of 50. 1 in 4. Now just stop and think about that in the Indian context. By 2050, and that's not very far away, nearly 20% of our entire population will be elderly. So you see, this isn't just a health issue. It's a massive socioeconomic challenge that's building up. And frankly, our policymaking hasn't really woken up to it yet. So we've laid out the problem, and it's a huge one. But, as it often does, science is pushing forward with potential solutions. Let's shift our focus now to a possible breakthrough that's causing a lot of buzz in the medical community. Exactly. There's a recent international clinical trial, now in a pretty advanced stage, that has shown some incredibly promising results. The therapy is called Lomecel-B, and what it is a single infusion of specially chosen stem cells. The early data suggests it might be able to directly fight the physical decline that is so characteristic of frailty.
And this is where you can see the real-world difference it could make. The study used a simple, practical test. How far can someone walk in 6 minutes? Well, 9 months after the treatment, the results were pretty amazing. Patients who got the highest dose could walk, on average, 60 meters farther. Now, 60 meters might not sound like a marathon, but for an elderly, frail person, that can be the difference between being stuck at home and being able to walk to the corner store. It's a massive leap towards independence and a better quality of life.
That is truly remarkable, Professor. Now, I'm sure all our aspirants studying biotechnology for GS3 are leaning in a little closer right now. Could you please break down the science for us? What is the magic behind how these stem cells actually work? Of course. So we're talking about a very special kind of cell called mesenchymal stem cells, or MSCs. A simple way to think of them is as the body's own expert repair crew. They have these 2 incredible abilities. First, they can actually change into other types of cells, like bone or muscle, wherever they're needed. Second, and this is what's really key for treating frailty, they act like tiny firefighters. They release molecules that calm down that chronic inflammation we discussed earlier and help repair damaged tissues. And maybe the best part of all, they don't trigger an immune response. Basically, the patient's body doesn't see them as a foreign threat and attack them, which makes the therapy so much safer. Okay, now here's a very important tip for writing your mains answers. It is absolutely vital to show a balanced view. Yes, these results are super exciting, but you have to remember that science is a marathon, not a sprint. You must mention that this is still in the trial phase. We need those larger, more conclusive phase 3 trials before something like this can become a standard treatment. Acknowledging these nuances shows a mature, analytical mind, and that is exactly what the examiners are looking for. Okay, so we've got this incredible scientific potential on one hand. But the big question is, how does this fit into the reality of India's healthcare system? This is where you have to connect the science with governance, which is a core skill for GS Paper 2. This slide really highlights a fundamental mismatch. You see, our healthcare system, including major schemes like Ayushman Bharat, is mostly reactive. It's designed to handle sudden acute problems, a heart attack, an accident. But an aging population needs a proactive system, one that focuses on managing chronic, long-term conditions. And frailty? It falls right into this blind spot. It's not even officially a reimbursable condition, so there's almost no focus on preventing it or managing it systemically. So with that gap in our system, if we ever want to bring a revolutionary therapy like Lomecel-B to India, we first have to talk about the gatekeepers. This leads us to the most critical piece of this entire puzzle: regulation. How do we make sure such a powerful technology is used safely and ethically? This is a classic governance and ethics topic.
Well, any new therapy like this would have to go through a very strict and long journey in India. First, it would need to pass large-scale Phase 3 clinical trials conducted on the Indian population. After that, it needs approval from our main drug regulator, the Central Drug Standard Control Organization, which you know as CDSO. The whole process must follow the strict guidelines set by our top medical body, the Indian Council of Medical Research, or ICMR. And even after all that, it would be closely watched for years to ensure it's safe in the long run.
And let's be crystal clear on this point. The role of the ICMR here is absolutely non-negotiable. We've unfortunately seen a rise of these shady clinics that prey on desperate people with so-called stem cell cures that are completely unproven. The ICMR's strict guidelines are our main shield against this. They are what draw the line between genuine, life-changing science and dangerous quackery.
Okay, let's just do a quick recap, because this is absolute gold for your revision. Just look at how this one single topic weaves its way through your entire main syllabus. For GS Paper 3, you've got the core biotech. For GS Paper 1, you have the social issues of our aging population. For GS Paper 2, it's all about healthcare governance and our regulatory bodies. And for GS Paper 4, you have the profound ethical questions that come with new medical tech. This is a perfect example of the kind of integrated topic that UPSC loves to ask about. And all this brings us to the big question we want you to think about, the kind of critical, analytical question you could very well face in your mains exam or even in your interview.
Exactly. How can India embrace the incredible potential of these biotech innovations while at the same time building a regulatory framework that is strong enough to make sure these treatments are safe, ethical, and, most importantly, accessible to all our people, not just a wealthy few? It's a tough challenge for sure, with no easy answers, but it's a challenge that your generation of administrators will have to tackle. Think on that. Thank you for joining us today, and we'll see you in the next explainer. Jai Hind.